But I just think some very fundamental strategic mistakes were made. And of course, smarter people than me have done analysis of what happened. But you basically you spend $100 million in advertising against it, which is what the insurance industry did, and then you spend all of that money, and then you don't promise people that they're going to be better off. They shook up the whole thing. And at that time, which I think is unlike, speaking to what you're talking about, I think it's different today. I think a much higher proportion of the people in America are unhappy, dissatisfied, financially strapped by, and scared about health care in a way that I don't think was really true to the same extent in 1993, 94. Because, people might not have been completely happy with their health care, but they had it. And for somebody to say, we're going to come in and we're going to do a whole new system, they did the the conservative thing, which is to be cautious. And you don't want to end up with something worse than what you have. I just think it's deteriorated so much now that many, many more people feel like, what the heck? We've got to do something better. We can't afford this. When every paycheck is being eaten, any increases that people have gotten for a number of years now have been eaten completely by increases in healthcare costs. So,
thank you. And one more question. Do you have any other questions?
Oh, come on.
Would you consider that the insurance industry is really motivated to keep health prices going up so it can get more people into their insurance policies? Because like insurance industry is being a big part of the problem instead of being part of the solution for the people.
I think I would answer it I wouldn't set up the construct of the question that way. I think there's a fundamental issue about what is insurance. And one school of thought is that insurance is where you get everybody in the same pool, and you all hold hands, and you all contribute, and you pray to God that you're not the one who needs it. That's social insurance. And you can have insurance companies in that, but they don't have any motivation for trying to keep sick people out. Because if everybody's in, and if everybody is covered in a way that across the whole pool enough money is there for them, then the insurance industry, in current day incentives of trying to make sure that nobody gets in whoever really needs anything a whole lot, and I personally cannot get health insurance. I mean, I spent 1 year, when I left the state, I spent a year after the COBRA ran out with no insurance. None. And the irony was just hysterically funny. I mean, I couldn't, and it wasn't about money. It wasn't about money. They would not offer it to me. They wouldn't give it to me. So I ended up in kind of this high-risk thing to do for a while. But I mean, so there can be, you can have a system with insurance companies that play roles of bill paying and, maybe competition, or perhaps trying to do healthy lifestyle type incentives for people. And, in South Africa, you get free movie tickets if you sign up with this particular, health plan, and you go to work out once a week at this particular gym. Then you get a free movie ticket every month. I mean, there are all kinds of creative. I'm not against the private sector having creative roles, which I think that can come. But there's that fundamental first question, which is everybody in or is everybody not in? And does everybody have access to it? And I also think you can't control prices until then. You just can't. You really can't control costs. As long as you have a quarter of the people out there who can walk into your emergency room. So, and frankly, have to, because they don't have other places they can get in. So, I hope that kind of answered your question. But I think the current role of the private insurance industry right now is counterproductive to trying to get control of costs. I don't see how we can. They will continue to go up.
Okay, well, thank you very much. And
Okay,
before we- Give you a small token of appreciation.
I hope it's not too small.
I don't know. If you need a small one, let me know.
No, that's good, that's fine. Thank you. Appreciate it.
Thank you very much,
Okay,
DeAnn.
bye-bye.